वैक्सीनेशन का कैंपेन 16 जनवरी को लॉन्च किया, वो किस तेज़ी से आगे बढ़ रहा है, उससे जुड़ी हुई पॉलिसी कितनी वाइब्रेंट है, कितनी डायनामिक है, उसमें भी आने वाले 1 मई से कितने बड़े चेंजेस होने वाले हैं। तो सरकार हर चीज़ों के प्रति पूरी तरह से सजग है। सरकार में होल ऑफ गवर्नमेंट और होल ऑफ सोसाइटी अप्रोच इसके साथ काम किया जा रहा है।
Hello everyone, good evening. You're watching News Epicenter with me, Marya Shakil. As India witnesses unprecedented rise in cases with over 2.6 lakh cases being recorded daily, the government has decided to expand the vaccination drive. So now every Indian above the age of 18 will be eligible for vaccination. In order to do so, vaccine manufacturers have been told to keep 50% of their stocks for direct sales to states, and they can make the jabs available in the open market at a predetermined rate. This comes as a significant move because the second wave is targeting the youth across the country. The government aims to keep the economy working and running, as the 18 to 40 age group is the bulk of the workforce. The move also aims to ease pressure on the health infrastructure and the supply of the critical drugs like remdesivir for more serious cases among the elderly. The problem of vaccine hesitancy is the least among the youth, and this will also help tackle vaccine wastage, which was a critical issue during the initial rollout. India currently has 2 vaccines in its arsenal, Covaxin and Covishield. The first batch of Russia's Sputnik V vaccine is likely to arrive in India in the next 10 days. It will be manufactured by Dr. Reddy's and production is likely to kick off in May. As the crisis continues, will the expanded vaccination drive help tackle the surge? What timeline could we be looking at where the vaccines help flatten the curve by creating a critical mass of inoculated citizens? Joining me on News Epicenter this evening, Dr. Anupam Sibal. He is the Group Medical Director of Apollo Hospitals. Dr. Rahul Pandit. He is member Maharashtra COVID Task Force, also Director Critical Care at Fortis Hospitals, Mumbai. Shankar Iyer, author, economist, someone who just has proposed this idea of geotagging of this COVID-2 virus, and Professor Dilip Mavlankar is the Director of Indian Institute of Public Health. I'm going to begin with you, Dr. Anupam Sibal. While we look at vaccination, the critical question is about mitigation as well. Do Apollo hospitals have enough medical oxygen for the next few weeks and months?
Good evening. Thank you for having me on your show. Well, I think we have entered a very decisive phase in our war against the SARS-CoV-2 virus. So we have multiple strategies. One, of course, is vaccination, and we'll talk about it. Second is this COVID avoidance behavior fatigue syndrome that has set in, which we need to address, where people are forgetting what would be the new norm or has been the new norm in behavior for the last 1 year. And then, of course, we have this whole surge that we are seeing in the last few weeks with the medical facilities being pushed. I have to say, in the last few days, as the pressure on us has increased, the government has made several decisions to ease that pressure. Of course, the curfews in different states has helped considerably. I think oxygen supply is back to where we wanted it to be. I think remdesivir production has increased because there was a shortage. I think also there has been this artificial hype, if I might say, that has been created about some medication like remdesivir or for TOSI or for plasma, because the indications are limited, they're very precise, and perhaps the lay public believes that that's the magic bullet.
Dr.
And if we don't get
that
remdesivir,
specific point that you made, that there is some degree of hype around remdesivir, and then you also said that this critical drug is being refurbished. So are you of the opinion that as of now, because of the manufacturing having been scaled up, there should not be any shortage, and if anything, if there is shortage in certain hospitals or in certain cities, this is because of black marketing?
Well, I really don't have access to that data to be able to comment on that. But what I definitely want to say is that the use of remdesivir, toci, plasma needs to be judicious. It's not for everyone. It's not something that you take lightly. It is to be given when the patient needs it. And if we are judicious about its use, we will not have a shortage because the production has been ramped up. We do have to realize that the cases have gone up, so the genuine need for medication has also gone up as the numbers surge. So there has to be a balance. But I think what the big concern the medical community has was that everybody believes that you have one of these agents or therapies, and yeah, that's going to cure you of COVID-19. But that is not the case. That was never the case. It's not the case today.
Okay. Okay. Coming on this, Professor Mavlankar, talking specifically about the new vaccination drive, which will begin from first, what do you see are the immediate challenges, given the fact that there are more anecdotal evidence clearly now that those who are needing hospitalization in this second wave are largely the young mobile population?
So I think this is a new decision is like music to our ears in public health. We were looking for opening up of the vaccine to younger people because these are the people who are mobile, they go around, they bring in the infection to their homes. And that is where it is a very, very important decision, should maybe have come much earlier, but whenever it has come, it is most welcome. What is the challenge now is to provide the supply of vaccine, because if you take people above 18 in India, there are almost 80 crore people who are above India. So you need 160 crore doses to be supplied, and which is a major challenge, and expansion of the vaccine portfolio as well as the manufacturing capacities need to be there, and expansion of the delivery capacity. I'm sure we have the delivery capacity because we have so many public, private, non-governmental organizations, primary health centers, general practitioners, so that's not so much of a concern. I think the main challenge is how do we manufacture so many doses and supply in a shortest possible time so that we can build herd immunity in the community.
And that brings me to Mr. Deepak Sapra. He is the CEO, API and Pharmaceutical Services at Dr. Reddy Lab. Mr. Sapra, thank you so much for your time. This specific point being made by Professor Mavlankar about vaccine manufacturers ensuring that there are vaccines when the scaling up happens from first onwards. Dr. Reddy is India partner of Sputnik V. You have told that you have communicated to the market that Sputnik V will begin its rollout only in early June. Given the exponential rise in cases that we are witnessing, is there a possibility of preponing it?
Sure. We are committed towards doing that. The way we are working out on the Sputnik program, we are not dealing in months or weeks or days. We're actually dealing by the hour. The way the situation is currently, with 240,000 people turning positive every day, it's about 10,000 people every hour. So that's how we are planning our activities and working both internally at Dr. Reddy's and also with our partners, both in Russia and in India, to see how much we can expedite the launch. So the goal is to get as much as possible, as quickly as possible, and we are working very hard towards that. The commitment we have is to launch it within this quarter, but every effort is underway to cut every bit of slack in the whole project timeline and get the vaccine to India as early as possible. Another point which might be relevant for you to know is that the vaccine.
What kind of timeline? Yes.
Yeah, the vaccine will come in through two channels.
Yes, go ahead.
The first channel is essentially based on import from Russia. So the product is made in Russia and imported into India. And the second channel is the product that's manufactured in India. Even within the product that's manufactured in India, we're looking at a fill finish option in which the bulk comes in from Russia and it gets filled in India. And the other option is we do the whole drug substance as well as the drug product in India. So we're working on these three work streams and trying to get it as early as possible and cut every bit of the timeline to bring access to Sputnik as quickly as possible.
So let's look at the timeline here. By when can India expect the third vaccine?
Yeah, So I think, as I told you, May, June is the time frame. We are cutting. Currently, it was June. We are working very hard to see if we can pull it forward by a couple of weeks. So that is, it's somewhere going to be in that time frame.
Yeah, and Mrs. Sapra, Sputnik V has 90% efficacy, but given the nature of the new mutant strain that is there in India, would it not have been better for you to have trials which are very India specific rather than relying on what has been done already?
Sure, I think that's a great point, Myra. And we have conducted both phase 2 and phase 3 trials in India. In fact, the phase 2 trials commenced in the later part of 2020. The phase 3 trials were done in 2021 in the month of January and February. So the approval that we have for Sputnik has a substantial amount of data from the Indian population conducted in the months of January and February 2021. So there is, while the Russian data is a large chunk of data, in addition to that, we have a very substantial and meaningful data both on safety as well as immunogenicity that has been generated on the Indian population in the past couple of months. So I believe as a combination of this, combination of the Russian data, which is the large global trial, plus the Indian studies that we have conducted, the phase 2 and 3 adaptive design studies, we have very meaningful and substantial data to demonstrate that Sputnik will be a very safe and efficacious vaccine for the Indian population.
One of the vaccine manufacturers in India, that is Serum Institute, had written to Biden administration saying that there is critical raw material which has been blocked by the administration. Is there similar problem being faced by you?
Right. At the moment, our supply chain is tightly knit and we have the supply chain under control. The components are coming in from various places, but I don't see a constraint in the supply chain at the moment. We have to scale up, we have to ramp up, we have to increase the
Last
production
question to you.
to make sure that we are fulfilling the needs of the Indian population. But the kind of constraints which you spoke about, we do not foresee that kind of constraint for Sputnik.
Yes, now that the government has said that the manufacturers can directly be in touch with various state governments, is Dr. Reddy's lab in touch with any of the state governments already?
Sure. So I think what the government has done yesterday in its announcement that in addition to the central government, the manufacturers are now free to reach out to the state governments as well as to private entities. So we are accessing every possible channel, both at the central government level as well as the state government level, and also at the private sector level, to make sure that this is the access to Sputnik is getting maximized. There are a few calls which have already come in from certain state governments. We are initiating discussions with them, and the goal here again is to make sure that Sputnik gets available to as many Indians as possible as quickly as possible.
Certainly, we certainly hope that as well. Deepak Sapra, thank you so much for your time and sharing all those details. Let me bring in Shankar Iyer. Shankar Iyer, this morning you tweeted and said that there is a need for a geotagging idea of the new COVID-2 virus because it is mutating in different forms. It's no longer the China virus, but there are strains coming up in various countries. Why this idea now?
Well, we've now 13 months since the or 13 or 14 months, 15 months if you see when it surfaced in Wuhan. So my point is very simple, that every country where a new variant is found gets tagged. Indian variant, UK variant, Brazilian variant, South Africa variant. But there is this tiresome political correctness about the original virus. Why shouldn't the original virus be also geotagged? And last month, a WHO team went to China on the invitation of China, and they couldn't find out why and where this virus originated. In fact, the WHO chief, Dr. Tedros, said that China didn't share information. Now, don't mistake me. I'm not into the xenophobia. I'm not making a nationalistic pitch. What I am specifically pointing out is that there must be institutional accountability, transparency on where the virus originated. And this is something that has to come. Why should India get tarred in the international press for having an Indian variant
or why should UK suffer the tag of a UK variant when the original virus is still called neutrally SARS-CoV-2? I think this is something that is tiresome, this whole
Okay.
woke behavior that we should not tag. I am not saying that the virus should be called Chinese, but it came out of Wuhan, it came out of China, so it is only fair that the geotagging should be there. And there has to be accountability. You know,
Fine enough.
140 million people have been infected, 3 million
So it should
people
be
have lost
Wuhan virus, despite
Yes.
yes.
Yes,
Despite
very
it
much so.
mutating in various ways. Dr. Rahul Pandit, since you are part of Maharashtra task force, now that the state governments have been made stakeholders in the entire vaccination drive, they can get directly in touch with the manufacturers. Which are the manufacturers that the Maharashtra government is already in touch with? And are you really prepared to scale up the vaccination drive from 1st of May?
No, I'm not privy to that information. We are a task force which actually gives scientific advice to the government, and which manufacturers the government is in. That I think information is with the government of Maharashtra. I will not be having that. I don't have that information. Sorry, what was the second question?
Yes. So I'm trying to understand, now that the state governments have been made stakeholders, do you think it is the move in the right direction? Because Maharashtra, for example, has been demanding that they should be supplied with more vaccines vis-a-vis other states which are not reporting as many cases.
I think absolutely it is music to ears, and this is what we have been saying as doctors all along, and this is what Maharashtra government had also put up a plea. We had taken up a middle path by saying that at least let's vaccinate 25 and above, but now all adults in the country have been allowed to be vaccinated, which is actually a very good move. And that was, Professor Malvankar said the same thing as well. It is the population which was actually stepping out of the house and who was probably responsible for spreading the virus as well. That population had the least amount of vaccine hesitancy, the young people, and we are seeing that in the second wave, a significant amount of people who are actually coming to the hospital are within that age group of 25 to 45 year age bracket, and at least I am seeing them in my hospital as well. So this is obviously the move in the right direction. What we need to do is, of course, speak with the vaccine manufacturers and secure the number of doses which each state would want, and obviously have that collaborated with the center as well. But what we need to do is that we need to actually increase the vaccination centers. I would say that we need to now step out. Door is not possible. This is an injectable vaccine. It's not oral drops. But you can go to the local communities. You can go to the local schools, Gram Panchayat offices, general practice clinics, wherever the vaccine can be given as per the norms, where you have 3 rooms to vaccinate them as per as per the rules set down by the government of India. We should set that up so that people, when they step out of their house, they don't have to walk too much to get a vaccine. That's the first thing. It would also declutter the existing vaccination centers, which by itself, because of the crowd, were actually probably becoming a super spreader event by itself, and were affecting people or infecting people who were visiting them. So I think we need to move in that direction. Obviously, in all of this, the cold chain maintenance needs to be looked at. We need to be sure that we're delivering the vaccine the way it should be delivered. All of these things are there. Logistics have to be worked out, and we will need to rope in a large amount of manpower to help us set up these vaccination centers so that we can actually come up to the as close to people as possible, so that the vaccination drive can actually have the real push and stimulus which it needs.
Yes. Dr. Sibal, since this requires large-scale manpower support as well, given the nature of mitigation exercise that is going on across the country, even as the vaccination is scaled up, is the decision coming too late, or will you say der aaye durust aaye?
Well, I don't think, Myra, it's coming too late. We do have to realize the kind of challenges that we are looking at. You know, India has a population of 135 crores. The phase 1 itself was very ambitious at 30 crores. We've given 127 million doses. So it requires time to scale up. It requires time to reach out to the corners of the country. And we have to acknowledge the fact that the news about some of the side effects has actually put this doubt of vaccine hesitancy in the minds of people. Otherwise, we would have vaccinated more. So we, as doctors, welcome this announcement, and I think we are ready to face up to the challenge of scaling up and making sure that vaccine availability reaches the doorstep. I think it's important that people shouldn't have to travel too much. According to the Indian Election Commission, nobody should have to travel for more than 2 kilometers to cast their vote. And for one resident in the Gir forest, every year, every election, the Election Commission sets up a polling booth. So we need to move in that direction if we are really going to scale up and reach out to the country. And I just want to make one important point. The youth today, they make campaigns
Please
go
go ahead.
viral. They make messages go viral. They set trends. And I'm pretty certain, we are confident that the youth, the power of our youth will make the Indian vaccination program go viral, and we will beat the SARS-CoV-2 virus through our youth. So I think we really welcome this, and youth power will prevail. I'm pretty certain.
We certainly hope that as well. Professor Mavlankar, before I give the final words to Shankar Iyer, quick 30 seconds to you, sir. Is the peak of the second wave still very far, or have we seen the maximum number of cases already? Is the worst behind us, or should we be prepared for more gloom and doom?
My sense is peak is still at least 3 to 4 weeks away, if not more. Once it starts, it's very difficult. Even if people maintain social distancing, mask sanitization, don't go out, lockdown, etc., still it will take 2 to 3 weeks if complete lockdowns are done in many places where the virus is very active.
Yes, so you're still saying that the virus, because it's very active and it has mutated in different forms, and certainly it has spread to rural parts of India as much as we see that the metros carry the highest caseload. Where do you think the mitigation exercise should be immediately plugged?
I think the main thing is to focus on
Professor
wherever
Mavlankar.
the cases are more. The main cities as well as small mufficil towns. And what we are seeing cases today are infected 1 week to 10 days before. So even if we impose lockdown today, for next 10 days, the new infections will keep on rising. So we have to really rigorously think of controlling crowds, controlling interaction of people through various mechanisms, and even use double masks, more distancing, etc. And still it will go up by about 30-40% than what we are seeing, and the mortality peak will come another 2-3 weeks after the case peak comes, because there is a 15 to 20 day delay in mortality happening after the infection. So I don't think we are anywhere close to the peak as of now.
Okay, Deepak Sapra, since you are still with us, Sputnik V, lot of, the sense is that if this another vaccine enters the market, the overall, okay, so we seem to have lost that line with Deepak Sapra. I would like to thank my guests, Deepak Sapra, Dr. Anupam Sibbal, Dr. Rahul Pandit, Shankar Iyer, Professor Mavlankar. Thank you so much for joining us and sharing your thoughts. This remains our top focus here on CNN News 18 and also on News Epicenter, because cases are continuing to rise and the peak is still very, very far. I'll return in just a bit. Thanks so much for watching.